This is my SL642 professional practice module video for a lateral meniscal tear of an 18-year-old female football player. We'll be going through knee range of motion exercises consisting of flexion, extension, lateral and medial rotation of the knee. We'll be going through quadricep exercises, which consist of mini squats, short arcs and quad sets. And finalising the strength portion of the rehab, we'll be doing some straight leg raises. To compare initial injury stage to post-rehabilitation stage, we'll be using some progression marker tests, which will be static and dynamic proprioception and the duck walk. To perform flexion range of motion, you want to drag your heel across the floor towards your glutes, stopping at the point of pain, holding for 2 to 3 seconds before releasing back down to the resting position. To perform extension range of motion, you'll be going the opposite way. The heel will be trying to go off of the floor as far as comfortable, with the back of the knee remaining in contact with the floor. Again, go as far as pain allows, before holding for 2 to 3 seconds and releasing back down to a resting state. To perform lateral and medial rotation of the knee, you want your hip at 90 degrees as well as your knee at 90 degrees. And with your foot, you'll be doing a waving motion. Inwards is medial rotation, outwards is a lateral rotation. Again, you go to the point of pain, hold it for 2 to 3 seconds before returning to the center as the resting place. From another point of view, this is what it would look like. Mini squats are performed the same way as regular squats, except you're only trying to go down to 40 to 45 degrees of hip flexion before holding and returning to a resting state. The short arc exercise is done with a smooth object underneath the knee as a form of support. The resting position is in slight flexion, and the objective of this exercise is to raise and kick the heel away from the floor with the rest of the body flat on the floor. The quad set exercise is performed similarly to the extension range of motion exercise at the beginning, except the heel of the floor is no longer trying to go away from the floor. It remains on the floor for the duration of this exercise. The back of the knee, however, is doing the exact same thing. It is trying to be pushed down into the floor. Again, the rest of the body needs to stay flat against the floor for it to work effectively. The final strength exercise is the straight leg raise. You no longer need any pieces of equipment, you just need a flat area on the floor in which your entire body can lay down flat. The only joint which should move and should have any angular change is the hip, the knee, and the ankle needs to stay relaxed but straight. There should be no other activation apart from the hip flexors. Now, static and dynamic proprioception will determine whether your balance and your stability within the ankle and knee joint has improved since initial injury through treatment and rehabilitation to post-rehabilitation phase. Statically, simply lift one foot off of the floor and try to remain on the other foot without falling over. To progress this further, you can close your eyes, and to regress, you can minimally distribute some weight onto the other foot. In an ideal situation, you would have access to a wobble board in which you could also use that to test proprioception. Again, in an ideal situation, when testing dynamic proprioception, you would have some tape to set up a star excursion test. But for this situation, you can simply imagine that there is a cross going from in front to behind and side to side. Again, you want to go onto one foot and lean and try and touch the imaginary tips of each point. During the initial stage of injury, this test may not be applicable, as going into a deep squat is sometimes painful for sufferers of a meniscal tear. If that is the case, you can skip over this part and come back later when swelling and pain has subsided. As just stated, what you need to do is go down into a deep squat and then waddle from side to side and forwards and backwards like this.